And we are back. Thank you so much for staying with us this far. We appreciate that you are still with us here on Good Morning Kenya. But in case you're just joining us, karibu tena sana. We send you lots of hugs. It is the month of love, as it was earlier noted. Let us know where you're watching us from this morning. You talk to us using the hashtag Good Morning Kenya on Twitter. Our official station handle is at KBC Channel 1 across the social media platforms. My handle is at Jain Wambui. So right now we want to move to our health segment, as we always do it every Tuesday, and today we are just here to have more of a learning experience and get to understand what we mean when we talk about sickle cell anemia or sickle cell disease. Today we have an expert and a champion in this particular area to tell us about their journey and also give us a professional understanding of what we mean when you talk about a sickle cell disease. So I'll start with the lady to my extreme left. She is Dr. Doreen Mutua, who is a pediatric hematologist oncologist working at Gertrude Children's Hospital. Good morning and welcome.
Good morning, Kenya, and good morning, Jane. Thank you for inviting me.
Thank you for making time to be with us.
Yeah.
And to my immediate right, we have Joe Mudukiza, who is a playwright and drama trainer, as well as a sickle cell awareness champion. Good morning and welcome.
Good morning. Thanks for having me.
Karibu tena sana. Now let's start with the basics. As we talked before we went on air, this is basically class 101. So let me start with you, Daktari.
Yes.
Sickle cell anemia, sickle cell disease, we all have our own understanding, guided or misguided, of what it could be. But what is it? What does it encompass?
All right. So sickle cell disease, sickle cell anemia, I will not split hairs because it's really not important. It's one big disease. It's a blood disorder.
Okay.
And that's very important for me to say that, because a lot of people come in thinking their child has cancer. And
because that's what we think we know.
Exactly. And I say, no, no, no. This is very, very different from cancer. This is actually a blood disorder. And it's inherited. That also is something very important for somebody to be aware of. And that means then you need to have it in your family history. The other thing is it's a disorder of the red blood cells.
Okay.
And because medicine, more or less, initially people would just describe what they saw. They saw that this disorder presented with red blood cells that look like sickles. I know people know the sickle to cut the grass with, and so they just called it sickle cell disease.
Yeah.
So what exactly happens is that a patient gets, or you get a mutation. And that mutation, when the oxygen levels go low, the red blood cell is usually like a donut. It's oval or round. It changes its shape from being round to a sickle. Now, that gives it a disadvantage because when the red blood cell is discoid, it's able to maneuver itself through the blood vessel. But if it changes its shape, then it becomes very difficult to move through the blood vessels, especially the small ones. So what happens is there is an obstruction of blood flow. And remember, what is blood carrying? Blood is carrying the food, the oxygen that is going to various tissues. So if there is an obstruction, then what happens is that tissue starts to actually die off. And so the hallmark of sickle cell disease is usually pain. And most patients will get a pain crisis, either a pain in the hand, a pain in the leg, a pain in the back, pain in the chest. And that's what most people will see and say, oh, I've seen a patient with sickle cell disease, and basically they tend to have lots of pain. Now, the body also has a way of detecting that these red blood cells don't look normal. So it tries to get rid of them. And that is what we get. As it's trying to get rid of them, it actually breaks these red blood cells and produces a yellow pigment, which we see in the eyes of most patients with sickle cell disease, that actually looks yellow. So we say they are jaundiced. But that will look, their tissues look yellow, their eyes look yellow. And because of that constant removal of the red blood cell, that's what brings the anemia. That means a low hemoglobin level. So basically, an abnormal red blood cell, the body is trying to get rid of it, you get the anemia. And also because of the obstruction of the flow of blood, that is what brings the pain. So the hallmark of sickle cell disease is really anemia, the yellowness, jaundice, and pain crisis.
Beautiful put out. Now, when it comes to the diagnosis of sickle cell disease, at what point can it be detected by a professional at least before, or is it at the point where we get to see the symptoms, or at what point can you as a professional detect it, or what is it called, give a prognosis?
Yes.
Yes.
So the diagnosis of sickle cell ideally can be done at birth.
Okay.
Remember, it's inherited, meaning right after birth we can actually do what we call newborn screening. We don't do that right here in Kenya, but there are plans to go on to do that, and you can detect it as early at birth. And within the first 2 weeks of life, a child, you'll know this one has sickle cell, this is a carrier of the disease, and this child is normal.
All right.
But in our setting, we wait for our patients to come in with symptoms. Then we test them. But unfortunately, that is also not a very good strategy.
Yeah.
Because a lot of children walk around in different hospitals being given blood, being given blood boosters, being treated for infections, misdiagnosed.
Yeah.
And so by the time they are really getting a diagnosis of sickle cell, it's already too late.
It's a bit too late.
And basically, so the best way to do it, as you heard, if I said, if you find it's within your bloodline, what you do, you have your children tested as soon as they're born. Let them be tested. Within about 2 weeks, you spin a specialist. The children, we started them on medications, and sometimes they never even end up with a crisis.
All right.
Yes.
Now, let me come to you, Joe. You know, you have lived a full life this far, but tell us a bit about the first time you got the diagnosis that, you know, you actually are a carrier.
Okay, I'm not a carrier. I have the condition.
Okay.
So
Apologies for that.
I was born with it.
Okay.
I did not know that I had sickle cell until when I was joining Form 1. I was going to high school in a different environment. So that's when my mom told me, but I was born with it.
Okay.
I was on medication since I was a child.
All right.
Yeah, so I guess they did not want to explain a lot to me, so they kept on telling me that I was a special child.
Kunywa hizi dawa, you're a special child.
So I kept on walking with a bag of medicine since like forever.
All right, so you got to know when you were joining high school?
Yeah, I got to know when I was joining high school because now my mom was leaving me at the school. And
boarding school?
Yeah.
And
I wanted to go to boarding school. They wanted me to go to day school, but I wanted to go to a boarding school.
All right. Yeah. Now, let me come back to you, Doc. You know, as a point of correction from just what he brought up, he was born with it, but then there's the carrier. What's the difference between those two?
So a carrier is just that they are a carrier of the disease.
The mutated gene?
Of the mutated gene.
Okay.
But they don't manifest the disease. So, and that is something very good to highlight.
Yes.
Because a lot of the patients who come in, or parents come in and they're told your child has sickle cell disease, but they say, but I've really never seen anyone in our family with it. And I say, no. The reason that you don't have any symptoms is because you're a carrier. But when you have two carriers, there's always a 25% chance that they can get a child with sickle cell disease. So it's possible in all your bloodline, you might never really have heard about sickle cell, but the fact that your child is now testing positive for sickle cell disease, then it means it's in your bloodline, and you're just a carrier. So carriers really are normal. They'll never have anemia, they don't have pain, but they have the potential to give the disease to their children.
All right, so you could be having the mutated gene, but it's not affecting you or symptomatic in any way?
Yes.
Okay, so that is the main difference. I told you, learning lesson, learning time here. Now, coming back to you, Joe, when you were first told by your parents that, you know what, you're a special child, I mean, growing up understanding you're special up until this time you went to high school, how did it affect your lifestyle, if it did in any way?
Okay.
From what you can remember and from what you've experienced this far.
So, since when I was a small child, I used to have pain crises all the time. And my parents wanted me to grow like any other normal child. So I would go outside, jump, play, then I come back crying in crisis. The next thing I know, I'm in hospital or first aid. Actually, my parents were very learned people.
So professional first aid givers.
Yeah. So as I was told when I was a child, I started manifesting the symptoms when I was like a month old. But then I was treated for malaria. So I kept on being treated for malaria. Then my mom decided that we should do the genetic testing
and screening.
And screening. And then they found out that I had sickle cell. And then they put me on medication immediately. But growing up, it wasn't easy. But knowing I was special, being told I was special, I'm a child. Okay, it's something to be happy about.
Yes.
I didn't know what that was, but
blissful ignorance in
I'm special. My mom comes, my dad comes with some fruits, pale kidogo, and then nobody else is being given that attention. So I'm special. I'm happy. I'm special. Now, when I got to Form 1, I'm being told that you have sickle cell. I actually don't know what that means. So I was like, okay. Until when I started having a lot of challenges in boarding school.
Okay.
Then there is the issue of stigma.
Tell us a bit about those challenges. Just hear from your personal journey, whatever you're comfortable sharing.
Okay. When I was in high school, a lot of people used to avoid me. I was in high school in 2009. People didn't understand what sickle cell was, and then there was this issue of being in a cult or something, because when you are in class and then pain crisis comes, you will have the pain. Sickle cell pain is very excruciating. You can't just sit there and pretend nothing is happening. You'll have to react to it, and most of the time you'll end up crying. So when you end up crying, maybe you faint or something, and then they take you to the sanatorium, and then people start talking. And then there is this thing, when you are growing up with sickle cell, you are small-bodied, because also puberty comes in late. So people start branding you names, like maybe they think you have HIV or something. Now that you're on medication all the time. During that time, people used to believe when you have a lot of medication, that is for specifically for a certain condition, when it was actually sickle cell. So in high school, I never used to have friends, because now everybody is talking negatively about you. So anybody who would want to be close to you, they'll have to avoid you.
There was a lot of hearsay going on. All right. Now, let me come back to you, Daktari.
Yes.
What are these health risks that come along with sickle cell disease, at least the known ones, which directly impact on an individual's life?
So, sickle cell is a chronic disease. We manage it. We are not yet curing it, but maybe we'll talk about cure later.
Yes.
So that means, like our warrior has said, and I really acknowledge and thank you for bringing out a lot of those stigma, because that's what keeps our patients or even our parents away from hospitals trying to seek help, because some of them are trying to hide and shelter their children because they don't want them to be labeled as a curse or to be told, why are you taking all these medications? So he's really brought out some of the misconceptions people have, even some of them thinking that it's contagious, and it's not, and not really understanding. Sometimes even teachers don't understand how painful that pain is, and some will say, I think your child is malingering. He doesn't want to go to school, or he doesn't want to play sports. And so we really have to raise awareness, and thank you for giving us that opportunity to do that, because sickle cell pain is real and nobody deserves to be. In fact, if you ask most patients with sickle cell, what's your most distressing symptom? They usually say, take care of my pain. All right? So basically the health risks of sickle cell disease, we can put them in two categories. There are those ones that will occur in the short term. We call them acute complications. Like, for example, the pain crisis, getting recurrent infections. And I'm glad he's talked about malaria, because if you look at the sickle cell map, sickle cell is largely an African disease. 90% of the patients who have sickle cell are actually found in Africa.
Is there a racial aspect to it in terms of the African or the darker tone race?
No, actually, it's really, I think, because of the geography of it and the environment. And what you'd find is that the sickle cell map and the malaria map are actually almost, you can superimpose them.
Wow.
And the reason, even in Kenya, you don't find sickle cell everywhere. You find it towards the lake region. You tend to find it also down at the coast, malaria dense zone. Because if you're a carrier of sickle cell, then you become immune, almost immune to malaria. So it's a way to adapt to that environment. But remember, carriers didn't have symptoms.
Yeah.
So when they come together, they get a child with sickle cell, and
gene.
Most of the patients with sickle cell are very susceptible to getting malaria. So infections, malaria, getting anemia, those would be now the shorter term that you would see. But in the long run, if sickle cell is also not managed appropriately, and that is why it's so important for parents to seek help, because there's so much we can do for our children. You get chronic complications, the organs start changing. You start having changes in the brain, changes in the eyes, changes in the lung, changes in the heart, changes in the kidneys, changes in the bones, the vessels. So those long-term complications, we can avoid them, we can minimize them by giving them the appropriate therapy.
Now, are there any other known causes of sickle cell aside from the mutation that has been so far detected?
No, actually it's a point mutation. That means it's one gene that has a mutation, and that is it. Yeah, so there's really no other way to get it. It must be something in your bloodline. You get that DNA from your parents and it's passed on down the line.
All right. Now, in terms of the treatment options that are available, let me hear from you, Joe. You know, you were used to taking medicines for so long. It became part of your lifestyle. Was that the main form of treatment you are receiving up until to date?
Yes. For sickle cell, the main form, we call it management, because there is no known treatment for that.
Okay.
So the kind of medication I used for management, I used them since I was a child, and I'm still using them up to now. And they are concurrent. You have to keep on using them, because sometimes if you stop, you find that the symptoms persist. The pain comes in more often. And also, my mom told me that there is also the issue of diet. We really observe diet a lot. So me, most of the time, I'm put on fruits and greens. So I avoid a lot of meat and a lot of proteins.
Why is that important, Dr. Just because that's a complete shift of lifestyle from what a normal child or teenager would want, but looking at the importance of diet when it comes to the management part of sickle cell disease.
So it's an interesting point, because coming from an expert, I usually get that question of, is there any special diet I should give my child to increase the blood levels? And I say, really nothing. Nothing will work for your child. Let this child eat healthy like any other child. But in terms of diet, I make a disclaimer: water. And I'm so glad I found our warrior carrying his water bottle. In fact, that's the first thing I'm like, when you're walking into the clinic, where's your water bottle? Because they need to take lots of fluids. Even the reason why he goes for sports day or he goes to play and comes back with a crisis is because of dehydration. So if he really wants to enjoy his time out, you must drink a lot of water. In fact, they don't drink the normal quantities. They drink almost 1.5 times more. If they do that, they can actually avoid. Otherwise, everything else in the diet is allowable. But I'm still happy they gave you that special diet that made you feel so special. And you're truly special.
Absolutely.
Yeah.
Now, still keeping up with this particular aspect of treatment and management, correct terminologies, we learn as we go, the management of sickle cell, and especially in the Kenyan space, how would you term it? How are we doing as a country?
Lots of progress on board. Because I know we are making small baby steps, but I really want to acknowledge them, because one of the things that we get our patients presenting very late. They come in, we wait for them to develop symptoms, and at that point is when we are diagnosing them, where they've had several blood transfusions, they've had lots of infections. Even a lot of our children don't meet their in fact, it was estimated that more than 90% of our children with sickle cell disease will not celebrate their 5th birthday. Why? Because they will die of malaria, they'll die of infections, things we could have prevented. So looking into how we can really have newborn screening is something very key. But recently we had the launch of the sickle cell guidelines. And what you find, even in Kenya, not most doctors know how to really treat sickle cell disease. So those guidelines help even a doctor in Mashinani, in Homa Bay, in Migori, just go into the internet, get those guidelines, and be able to actually see how do I manage each, and they're simplified, they're there, and you can be. So we are also trying to see how can we be able to get newborn screening, diagnose them as early as possible. We are in talks to see how can we subsidize the drugs. He says we manage this disease. So that means he has to take medication for the rest of his life. But it's possible to take those medications and have a very full life, a normal life expectancy. So that is still okay. But also beyond that is sickle cell can be cured. All right, and I'll really just say that because a lot of the patients are now reading about bone marrow transplants and gene therapy, and I say there's a lot of science going back in the background trying to see how can we cure sickle cell. All right, and I can see the next 10 years we'll be talking something very different about sickle cell, and I only pray that we can make it accessible to our patients, because not all our patients can be able to get out to go and get a transplant. But yes, it's possible.
It is
gene
possible.
Therapy, as we said, it's a point mutation. So gene therapy just goes actually to, it sends almost like a small vector, goes to the gene
specific
and actually
gene.
corrects it.
All
and
right.
we cure sickle cell.
Remember, this is all about sickle cell anemia, sickle cell disease, however you choose to refer to it. We're just trying to create more awareness around this particular condition. We welcome you to share with us your questions, comments, or if you're just seeking clarification, use the hashtag #GoodMorningKenya on Twitter. We take a very quick breather. We'll be back to continue with this discussion. Don't go anywhere. Thank you for staying with us. We continue with this beautiful discussion today, all about creating more awareness around the sickle cell disease. With me in studio, we have Dr. Doreen Mutua, who is a pediatric hematologist oncologist working at Gertrude's Hospital, Children's Hospital, and we also have Joe Mudukiza, who is sickle cell warrior as well as a playwright and drama trainer. Now, let me come straight to you, Daktari. This goes back to something that we had mentioned earlier, in line with what Joe said he was passing through because of the misunderstanding that we have around sickle cell disease. And I'd like to start with the whole question of life expectancy, because as rightfully put, in as much as we try to distance ourselves from culture and taboo, there is also that influence that it has in some of these diseases, people thinking it's a curse or, it's a taboo, therefore, utapita hii miaka. When it comes to the life expectancy of someone who has sickle cell disease, clear the air for us there.
All right. So I'm looking at the average life expectancy of Kenya being like 47 years.
Okay.
On average, I think. Slightly more for women, maybe 48 years. So sicklers can actually live. But the key word is early treatment, early diagnosis and early treatment, so that you avoid those chronic complications, because those chronic complications are what end up resulting in a shortened lifespan. So like I was clearly saying, that Joe is very lucky. He's among the children who crossed their 5th birthday. You could see most of our children die before 90% die before 5 years.
Okay.
But that really is something that is changing, and we are now beginning to see doctors who are sicklers, pharmacists who are sicklers, engineers who are sicklers, bankers, a playwright, a drummer, so a teacher. You can find all these careers have people. So it is possible. We know elsewhere in settings where they really look after their patients from pretty young, we've had people live up to 70, 80 years, university professors. So there is a lot of hope.
Okay.
But we must demystify sickle cell and take off this myth so that people are not afraid to come out and bring their children to be tested and to be treated, because it's something we can do.
Now, still keeping up with, trying to live a managed life, we also find as parents, we get overprotective. My child has sickle cell disease, so I will protect them, and rightfully so, as every parent would want. But when it comes to understanding that they can also live a full life while still, managing the condition, because you find most are kept away to just protect them. How would you clarify that area when it comes to allowing your child to just be while still helping them protect themselves?
So that's a very good question, because being inherited, a lot of parents actually blame themselves. They're like, I probably gave this to my child, and over time they start learning, oh, your child has to drink a lot of water, your child has to be in hospital, they don't want a pain crisis, so they start guarding. But then what that does is really to shelter this child and not allow them to achieve their potential. There are medications that we start very early on, and one of them, and I put a big highlight on it because it's really the game changer for sickle cell disease, is hydroxyurea. And that hydroxyurea at an appropriate dose, some children, even their anemia is corrected. They don't even have pain crisis. If they take their water well, they get all their vaccines, they're taking their antibiotic, their prophylactic antibiotics. These are children who really can go for sports day, they can enjoy. Sometimes if the water is nice and warm, it's warm weather, they can have a swim. So we allow and we really counsel our patients, please do not make these children like small eggs. Let them experience life.
They can live a full life like any other child. They can live a full life. All right. Let
them enjoy themselves. Don't make them feel that, oh, because I'm a sickle I can't do. Because then when you quickly see them in their teenage years, that's a time you're having lots of problems with our children with sickle cell, because they've already developed complexes within themselves. Like, I'm very happy Joe survived high school and he did it without many issues, but I promise you it becomes a terrible time, because now they're in charge of their medication, they're in charge of knowing I need to take water, they don't understand why this is happening to them. So one of the journeys we also work with the parents with is how to disclose. And from a very young age to start teaching them what is sickle cell. Yes, you're slightly different, but this is why are my eyes yellow? This is it. But you're beautiful, you're handsome the way you are.
All right.
So that they learn accepting themselves early.
Now, that brings me to the whole aspect of awareness, Doreen. This goes back to a petition you made a few years ago. Tell us a bit about that.
Okay, before I go to the petition, there is something Dr. has talked about. I would want to
go ahead
to clarify about it. Okay, medication. There is medication, yes, and people are using the medication. But then we forget at a point where we have those people in the village who can't afford that kind of medication. Sickle cell medication is very expensive. At the cheapest you can find hydroxyurea is probably maybe 45 shillings. But during the pandemic, one pill, and you need to take one every day. During the pandemic, in the villages it increased to around 75 shillings. So you find there is that gap whereby there are some people who can manage to afford, but there are those who can't.
Don't have even access to it.
So you'll find most of the people who have sickle cell are children between the age of 1 to 15. Why? Because most of them don't live to see adulthood. So they die because they can't get the medication. And then you go to the village, there is this misinformation that maybe this is a bad omen, or maybe the mother contributed to it and not the father. So most of the children with sickle cell don't actually live with fathers because they end up being sent away.
Excommunicated.
Yeah, you find in the villages it's very common. So that is why most of the times I take my awareness to the villages. Now, let's come to the petition. I did a petition a few years ago when I was 19, now I'm 27, to Parliament to declare sickle cell a national health priority and also to subsidize the medication that people use. Okay, Parliament has a lot of legislations that they are looking into, a lot of bills that needs to be passed. So not taking something to Parliament makes it so special, or they have to take it into consideration because people are dying. They'll tell you you have to wait. We've been waiting since then. We took it with Isaac Maura. We've been waiting. He's been following up, but then a lot has not been done on it. But at least we made a point whereby they had to recognize the condition. If you go to hospitals, you will find that sickle cell has not been listed among those non-communicable diseases. It's not there. Probably they have listed it recently because the ministry has been working a lot on talking about sickle cell and finding legislations that could work.
So how then, as we bring the conversation to a close, when it comes to building more awareness around sickle cell disease, what practical ways would you encourage each and every individual to venture into or to look into to just try and, be that carrier of this message?
It's not easy to do awareness because awareness, it needs a lot of funding. Yeah, and most of the awareness that you need to go there. Okay, not everybody's watching TV now. We have those ones who
Kenya is
really
watching.
need.
Kenya is watching.
It's watching, but not everyone.
Yes, I hear you.
Yeah, so you'll need to go to the villages.
Yes.
That kind of awareness is expensive. Now, me, I manage it. I used to manage it because my dad used to assist me. He used to fund me to do the awareness until he stopped. So taking awareness, okay, he died. So from cancer 6 months ago. So he was the one who was funding a lot of my awareness. But now I have to do it out of my own pocket. But what I would like to encourage is everybody, anybody who would want to encourage others, just talk to them. Encourage them. You find patients with sickle cell, they don't want to talk about it. They don't want to go to hospital.
If so it takes a mental toll.
You talk to most of them about the condition, they'll shut you down.
Okay.
They'll ask you not to do that.
So hear from the individual to understand.
Yeah, starting from the ground, making it normal to talk about it so that people can understand. And then there is this treating people like they are special people. You meet someone who has sickle cell because they are small-bodied, you brand them names or you call them different things. It makes them to shy away, so they won't talk about. But again, acceptance is very important.
It starts with the individual.
It starts with you accepting that you have the condition and knowing how to manage it on a personal level.
Okay.
That is very important.
It's part of the starting point of the journey.
Yeah.
All right.
If you don't accept it, then you could as well condemn yourself to death.
All right. Now, coming to you, Daktari, again, very briefly, still on that aspect of creating more awareness and now looking at even our professionals who might not really know how to pick it up when it comes to symptoms, when it comes to following the guidelines, looking at the professional space, how can we create awareness even in that space to just make sure that, we are all working towards the same goal?
All right. So I'll quickly say that there's a World Sickle Cell Day.
Yeah. It's
June 19th, and we celebrate it every year. And every year there's a theme that we would. And I think over the recent years we've had several walks, a lot of advocacy activities on that World Sickle Cell Day, and sometimes even spanning through the week. Basically, the National Sickle Cell Guidelines are a real go-to because they teach you everything that you need to. As a doctor, yes, you might have had a little bit about sickle cell, but the nitty-gritties of what to do with it, how to diagnose it, when to suspect it, you can easily get that. They're accessible. If you have a bit of bundles, you can download them and actually just have them on your phone.
Okay.
Then we have the Kenya Sickle Cell Foundation. Please, we all work with each other, the Kenya Pediatric Association. We are all working together, public and private institutions. This opportunity you've given us, there's a lot, somebody who's heard a little about sickle cell, and maybe whatever you can, just share that information, that this disease can be managed.
Yes.
You don't need to hide. It's not contagious. It's potentially going to be curable soon for patients who need that, but they can live very fulfilling lives with just good comprehensive care of these patients.
All right. Now, very quickly, there's some few questions that have come in. We have Kibet, I'll just be mentioning one name, who is asking, how do you know you are a carrier?
Okay, that is simple. Again,
very briefly, I'm told we are almost out of time.
Yes, blood test. A blood test, we put it in the machine and it will tell us what's your blood group.
So just go for blood work and you'll be able to
tell.
The professionals can tell.
Yes, yes.
All right. Thank you so much for being with us today and sharing from your pot of knowledge and your experience as well. We appreciate that. Once again, we have been speaking with Joe Mudukiza, who is a sickle cell warrior, as well as a playwright and drama trainer, and Dr. Doreen Mutua, who is a pediatric hematologist, oncologist. That is a long title. Working at Gertrude's Children's Hospital. Thank you so much for being with us. That is that from us here on Good Morning Kenya. We'll be back again tomorrow morning. My name is Jain. Do enjoy the rest of your viewing.